This is my client, Agneta, who flew from Connecticut to the Hesch Institute in Aurora, Colorado. And I asked her to give us a summary of her, her experience of trying to get care for her back and leg pain over the last 8 years, and give us a summary of what she experienced here at the Hesch Institute. And so I'll let her give a recap of her story.
I am suffering from low back pain and pelvic pain since 8 years, since 2010. I was desperate because it was very uncomfortable having that pain. I started to see physical therapists, chiropractors. Altogether, during these 8 years, I have seen around 14 physical therapists and 2 chiropractors. And every time I went somewhere, I was hoping that they will help me. Instead, every time after every treatment, I just got worse and worse. Perhaps 3 of them didn't hurt me more than I was hurting already. So I was desperate to find somebody. I was doing research on the internet, and I found Dr. Hesch. And I was hoping that he can help me. At that time I was already, I could walk just a little bit. I had a sedentary lifestyle. I gained weight. My physical condition got worse and worse. So I was desperate. I flew to Colorado. Yes, before those PTs and chiropractors were very aggressive. Their style of treatment were very aggressive towards my lumbar spine and pelvis. And however, I told several times that I'm getting worse and worse. It was disregarded. I was told that I have to be worse before I get better. So that's how I get to the point that I couldn't walk anymore. I couldn't stand in an erect position. I had this sedentary lifestyle, and I was desperate. So after doing a lot of research, I found Dr. Hesch. Oh gosh, if I would have found him earlier, it would save me all these sufferings and all this money what I spent over the years, which was around $30,000. And so I came here. He evaluated me. He found what was the problem, and he, with a very gentle approach, he resolved my downslip, which was the main problem, which from the very beginning, and that was getting worse and worse with the other style of treatments. And after 2 minutes or 3 minutes of treatment, my downslip was resolved. It was amazing. I get up from the table, and I could not believe how easily I could move, I could walk. Also, he worked on my low back, and now I can stand. I can walk easier. I still have a long way to do. I have to do exercises. He taught me what I have to do, because being for so many years in that bad posture and everything, I have to teach now my body to function correctly again. But I hope that I will be able to. And he's a formidable doctor. I have no words to tell you how grateful I am for the work he was done with me.
And I should thank you for coming out here. That was a leap of faith. And I was so worried because I read your MRI reports and x-rays. And you remember on the phone we talked, and I said, yes, what about surgery? Yes. And you said that in 2010 they had told you no surgery. But I kept thinking, oh my gosh, this might be a surgical case. But then when we talked and taking your history, I started to become more confident that maybe I could help you.
Yes, that's what
And,
you told me.
You know, certainly we can't reverse the degenerative changes in your spine, but we can work around that.
Yes.
And those things happen slowly over time, and the body can usually accommodate them.
Exactly.
And of course, you had a few injuries, a few falls, and
Yes.
abrupt forces the body doesn't integrate
Yes.
well. So we just had some, you know, some gentle work we had to do to kind of bring your body back in alignment with the way it was made to work.
Yes, my whole body, I felt that my whole body is misaligned. My upper body wasn't working in harmony with my lower body. My right side wasn't in harmony with my left side.
Uh-huh.
It was awful. Like I would be put together from pieces, but the pieces didn't match.
Ah.
So it was awful, the feeling I had before. And I remember when you called me and you told me that I might need surgery, and I just couldn't talk for a minute.
Oh.
I was so scared, and then I explained to you that you are my last hope. And
It was a question.
Even if you can't help me, I still would like to come and see you.
Yeah.
Because even if I need surgery, being misaligned, it would be a failed surgery, I think.
And how do you feel now in terms of your ability to treat yourself? Because you're going to fly back to New Hampshire, to Connecticut tomorrow.
Yes, and I'm very sad because I'm at such a huge distance from you. But I hope I will handle, and I will call you. I will keep
Sure.
in touch with you.
Sure.
And if I need, I will come and see you again.
Right, right. And we put things on film for you and
Yes,
taught you how to
film.
do them.
Yes.
And so you
I
have
hope-
those.
I hope that I will be able to handle, because you explained to me everything, how to do it, you showed me, so hopefully
Yeah.
it will work for me.
Very
and
good.
if it's not, I will come back.
We'll be here. We hope that you don't have to come back. That's why we put everything on film.
Yes.
You know, we try to make it so you don't have to, because you've seen enough people.
It was, oh yes, and as I told you, you were my last hope, and I'm so thankful, and I'm so happy that I did this trip, and you helped me.
Yeah, I'm just a big advocate for gentle forces.
It is
Gentle,
so
prolonged forces on a fulcrum.
You are so.
You know, just an arbitrary example. We put, a vertical force through the hip to move your ischium back up, to move the hemipelvis back up for the downslip, and that's just a one-time treatment. If it's done correctly,
One time.
that should be a one-time correction, not every day, not keep coming back to see me.
And
None
it
of that.
was uncomfortable at all. I was amazed when you said that, okay, it's done. And I get off from the table,
Yeah.
and I felt that
It's
really
a precise
done.
it's a precise treatment, because you have to find the correct angle that allows you to create a superior glide.
It's
And
very
that
precise.
happens to be with your body. That was 15 degrees of hip adduction. And
It was formidable. You are so.
yeah, there's a role for
excellent.
treating the body for posture, and there's a role for biomechanical treatment, and there's a role for patient education as well. And we try to cover all those bases and give the power back to the patient.
You are formidable. I would never think about that I would meet someone like you.
Well, thank you for
I've
your
never
kind words.
seen somebody like you in my whole life, and you're excellent.
Thanks for your kind words. I appreciate it.
Thank you for treating me.